Good morning everyone and welcome to the Want to Know More About Health and Wellbeing in Leeds Libraries session, which is a free webinar that is going to be delivered by myself, Becky Cumworth from the Public Health Resource Centre, and my colleagues Lisa Fawkes and Andrea Ellison from Leeds Libraries. It's the 27th of January 2022, just after 11 AM, and the session will be finished by 12 PM at the latest. Leeds has a wealth of libraries for both the public and for health professionals. All Leeds libraries have a role to play in helping people to learn about health, in reducing health inequalities, and in promoting health and wellbeing for all. At this session, you will learn about the health and wellbeing offers available to the public through Leeds Libraries and to professional through Leeds Health Libraries. Between us, Lisa and I and Andrea are going to cover how Leeds Libraries are supporting the 5 ways to wellbeing, health and wellbeing events and activities in Leeds Libraries, learnable resources that link to health, such as books on prescription, volunteering opportunities at public libraries, such as Reading Friends, and training and resources available to help you discuss health matters with others. We're going to start with the final point, and I'm going to spend a few minutes telling you about the training and resources available to you through the Public Health Resource Centre and the city's other professional health libraries, before handing you over to Andrea and Lisa, who are going to take you through the public libraries offer. On screen now is a cartoon featuring 2 men, one of whom is dressed in a way that indicates he's a medical doctor. The doctor is speaking and the other man is listening, and the caption under the image reads, "More and more patients are going to the internet for medical advice. To keep my practice going, I changed my name to Dr. Google." It's a humorous cartoon that touches on all the different places health information is available these days, not all of which are reliable. I'm going to play you a short film in a moment which covers the health information available from PHRC. But before I do, I want to assure you that all the information you get through public health training or from the Public Health Resource Centre is evidence-based. That means it's been rigorously scientifically tested and proven to work. There are many confusing messages about health and wellbeing out there, and if your role involves promoting health, you want to feel confident that the information you share is accurate, current, and reliable. I will now play you a short film which covers the resources and training available to you from the Public Health Resource Centre, which are provided with the aim of helping you promote health to other people. It's just under 4 minutes long.
The Leeds Public Health Resource Centre, or PHRC, is a health library that supports anyone with a responsibility for or interest in promoting health and wellbeing in Leeds. It is located inside the Tech North building, which is in Chapel Allerton. You can borrow interactive health models and games, books, DVDs, teaching packs, and reports on a wide variety of public health topics. We also have leaflets and posters available to order that you don't need to return. There is no charge for any part of the service offered by the PHRC. The centre has over 4,000 resources in total, covering a breadth of health information topics. In our library, you can loan up to 10 items at a time for 3 weeks. We hold books covering health topics and mood-boosting fiction, teaching packs and games, which can be useful aids for broaching subjects like emotions and nutrition with young people. We hold hundreds of leaflets and posters available to order for our members, free of charge, made by our partner organisations in Leeds, the NHS, public health and charities. We have leaflets and posters available covering wellbeing and health conditions for all ages, including immunisations, nutrition, cancers, mental health, smoking cessation, help with managing money, and local Leeds health services. As a member of the PHRC, you can loan up to 5 health models at a time. We have over 200 health models to help further illustrate health topics, covering mental health, drug and alcohol awareness, dental hygiene, cardiovascular disease, smoking, healthy eating, and general anatomy education. Once again, all our resources at the PHRC are free. You can search for them on our catalogue at www.leeds.gov.uk/PHRC and click the Search Our Catalogue button. You can also find details about how to order and collect leaflets and posters and how to borrow and return resources. In addition, the PHRC website contains a variety of information about public health in Leeds, which you can explore at any time. This includes information about current campaigns, services, initiatives, strategies and statistics. The Leeds Public Health team also offer training sessions on a range of health topics. You can find out more about upcoming sessions and how to book by visiting www.leeds.gov.uk/LPHT. We have a regularly updated playlist of training and want to know more about webinars that have been delivered online and published on YouTube, which can be viewed at www.bit.ly/LPHTfilms. To join the PHRC, visit www.leeds.gov.uk/PHRC. Click on the Register with the PHRC and complete and submit the online form.
For the latest information about the training and resources available from the Resource Centre and about public health in Leeds, find and follow @PHRC Leeds on social media.
I hope you gained from that film that although the PHRC is a library, it stocks more than books alone. Obviously, we do have books, lots of books. We have textbooks that are evidence-based on a range of health topics, but we also have books containing personal stories from people with lived experience of particular conditions. We have DVDs, games and activities, models, teaching packs, leaflets and posters, and we deliver training and events. Some of our resources are most suited to helping you to learn about health topics that you're interested in, and some are designed to help you have conversations with other people about health and to help them to learn and explore health issues. How can you access the centre? First, join up for free online via the PHRC website, leeds.gov.uk/PHRC. You can then visit the centre to browse the collection, but please be aware that at the moment this is by appointment only during the pandemic. You can email phrc@leeds.gov.uk or call 0113 378 6200 to arrange a visit. Alternately, you can use the online catalogue on the PHRC website to search and place a hold on resources. You can also search for leaflets and posters on the online catalogue and then order by emailing phrc@leeds.gov.uk. You follow us on social media at PHRC Leeds for information on the latest campaigns, events and resources. And when you join, if you sign up for our 2 newsletters, we have Public Health Effectiveness Bulletin, which is about what's going on in public health in general, and then we have the PHRC newsletter, which is about what's going on in the centre. Before I finish and hand you over to Andrea and Lisa, I just wanted to mention that the PHRC is one of 6 professional health libraries in Leeds. The others are available to people who work in the organisations that they exist within. Leeds Community Healthcare Library is for staff in Leeds Community Healthcare NHS Trust. 3 libraries are available to staff within the Leeds Teaching Hospitals Trust, and they are Leeds General Infirmary Library, St James's University Hospital Library, and Wharfdale Hospital Library. And the Mental Health Library is for staff within Leeds and York Partnership NHS Foundation Trust. There is an interlibrary loan system in place that operates across these 6 libraries, which means if you join the Public Health Resource Centre and we don't have the book you want, but one of the other libraries does, you can still borrow it and you'd still collect it from and return it to the Public Health Resource Centre, and the task of moving items between the libraries is done by us behind the scenes. Are there any questions before I hand you over to Andrea and Lisa? Will you take that as a no?
Okay, thank you, Rebecca. So as Rebecca said, my name is Andrea Ellison. I'm Chief Librarian for Leeds Libraries, and I'm joined this morning by Lisa Folks, who's our Senior Librarian for Health and Wellbeing. I'm just going to begin with a few words of introduction about our service, and then Lisa's going to cover in a little more detail about how our public library service in Leeds supports the 5 ways to wellbeing. So libraries are a statutory service. They're part of a national network of 150 libraries, and this national resource, has the potential to play a really important role in supporting the health and wellbeing of our communities, as I hope our presentation this morning will demonstrate. So as a service, we're guided very much by our National Libraries Universal Offers programme. This programme was introduced really to help more effectively communicate the library offer, and to demonstrate the power of libraries to enrich the lives of individuals and communities. Health and Wellbeing is one of the 4 national universal offers, and each universal offer is supported by some calendar spikes. And this slide here basically outlines the calendar from January through to December with various dates highlighted. And so libraries across the country all come together to support these universal offers by focusing activity around the dates and themes in the calendar. More specifically, libraries contribute to the public health agenda by providing access to independent, trusted sources of information, supporting health literacy, and through a range of programmes of activity to support wellbeing. And our presentation will cover the key elements of this offer as we are developing it in Leeds and as we come out of the pandemic. But I thought it would be useful to begin with a little bit of background information about the public library service in Leeds to provide some context. So across our city in Leeds, we have 34 libraries. We annually welcome around 2 million visitors a year of all ages and from all backgrounds and all sections of the community. And we have around 300,000 members. That means that actually we have 300,000 residents in Leeds who hold a library card. We have a mobile fleet of vehicles as well. We have 4 mobile community hubs. We have a mobile library, which it's not quite on the road yet, but when that starts to go out later in the year, that will be providing a service primarily to the care homes. And we also have our 2-storey buses, which are aimed to engage children aged 0 to 5 and their families in the joy of sharing books and reading, so supporting early speech-language communication and school readiness. So I would say it is one of the biggest city library services in the country. And I think all these figures, these numbers, 34 libraries, 2 million visitors, it's a really important part of our story. And it really does help to evidence and demonstrate the extensive reach of public libraries into communities, as well as the cradle-to-grave nature of our service. So the physical building is a really important part of our offer. Our library buildings provide safe, welcoming, trusted spaces for community use and engagement in the heart of local communities. Our libraries are open for everyone to go and to share the resources and to share the spaces, all of which helps to build a real sense of trust, which is so important for the development of stronger, healthier, connected communities and community cohesion. So increasingly, I would say our libraries are about connections as well as collections. They're free spaces, there's no need to make an appointment, and that makes a really important contribution to that loneliness and isolation agenda. In Leeds, we have an interesting model of running our libraries. We're integrated with customer services to provide a network of community hubs and libraries. And there are really huge benefits to us as a library service in this, what I call knitting together of services, because there are many customers who need access to customer services, but who would not maybe be traditional library service users. And so we're able, through this partnership, to extend an invitation to these customers to join the library so that they can benefit from the rich, free and diverse service that we have on offer. And in Leeds, we have really been investing in our library spaces as part of the community hub development. The original library buildings have generally provided the site for the development of the community hubs, and restoring some of these historical buildings has been a really important and really appreciated way to connect people to their past. Our vision has been very much to bring the buildings back to life, to create a contemporary place with a connection to the historic past, a space for everyone to go and enjoy, a space in the community with well-being at the heart of its offer. And I've just got a few slides now to give you a sense of the quality of some of our refurbishments. Okay, this first slide shows an image of Armley Library. This is a fairly recent refurbishment and restoration. You can see it's a really magnificent space, and you can see how the original features of the parquet floor, the lighting and the roof have all been restored to their former glory, and how we have also, the library shelving, we've now been using a style which really complements the historic features but creates a sense of a modern and contemporary space. The second slide now shows another one of our more historic buildings. This one is Morley, and this shows an image of our children's library where bright and colourful furniture really brings the space alive. And, the use of soft furnishings like the rugs really soften the hardwood flooring that we have actually restored as well. And then finally, the final slide I've got is just to really say that we're not just restoring the historic buildings, we're also upgrading some of our more modern buildings. And what we're looking to do there is to really incorporate where we can some special features, particularly in our children's libraries, very much aimed at engaging children and families and bringing the spaces alive. And these are a couple of the features that we've got in. These are actually two images from two separate libraries. The one on the left shows the giant book, which is at Compton Library, which also creates a little mini stage for children. And on the right, you see one of our features, which we're using in a couple of libraries at the moment. And this is our space rocket. And so you can really get a sense of how exciting these environments are for the children and their families. But of course, it's not only about the building and the spaces, it's really as much about the activity, the services that are delivered from the building. It's about how we use these spaces and take our services out into communities as well. And so Lisa's now going to give us an overview of that service provision, and in particular, as I said before, how our service supports the 5 ways to wellbeing.
Okay, so as you can see here, we have structured our offer around the 5 ways to wellbeing, as we think that libraries have something to contribute to all of these through our varied programmes of work. As you can see on the slide, the 5 ways to wellbeing are connect, be active, take notice, learn, and give. So we start with connect. Connect is one of the most obvious ways in which we can contribute through our spaces and the activities which take place within them, and through our friendly and knowledgeable staff. We know that library spaces are trusted, safe and welcoming, and some of the comments you can see there are from a recent survey. So it's saying friendly and helpful staff, easily accessible location. All Leeds libraries are amazing. We go regularly. The books are a great selection for kids. We've restarted events, stories and rhyme times are back. Workshops, talks and work with groups, and we're planning much more in the near future with regular library socials every week at several libraries across Leeds, and social tables providing an opportunity for informal chance connections and conversations. All of this work is aiming to tackle social isolation and promote community cohesion. We'll also be expanding our programme in more specific areas, such as people living with dementia, those who have been affected by bereavement or have an interest in grief and loss, people living in care homes, and people who are experiencing homelessness. We contribute to health in terms of promoting physical activity via our stock. The very fact that libraries are community-based and customers can walk or cycle to visit us, and we've produced some walking maps and walking trails for people to follow. We're developing more work in this area in the near future. Let's Move in Libraries is an international initiative which uses the impressive reach of libraries to support healthy communities through activities such as walks from the library, exercise sessions, cookery demonstrations and more. We're in discussion at the moment with Active Leeds about what this programme might look like in Leeds.
We talk here on this slide about reading fiction as a mindful activity. So myself, I find doing mindfulness quite tricky. I always keep thinking, have I drifted off? Have I done it long enough? Whereas actually reading takes you to that different place. It allows you to be in the moment. But you can do that online as well. So we have a vast array of obviously ebooks. We have e-audio, we have e-magazines, we have e-comics, we have e-newspapers. And in terms of that cost of living agenda, that's massively important. I think it's a treat if I buy myself a magazine. that you can actually access the latest magazines online for free. So I think in terms of our digital offer, our support for developing literacy skills, there's lots we can support you with there.
So we are on to the Learn part of it. So we've always supported the learning agenda, and this continues to be important to us. We provide access to a wide range of informal learning opportunities, books and research titles, and talks and workshops as well. And we mention here Reading Well collections, which support people to understand and manage their health and well-being through reading. I'll be talking about those a bit more. The Reading Well book lists, you can see there's Reading Well for children, Reading Well for mental health, Reading Well for young people, for long-term conditions and dementia. This is a shared programme between the Reading Agency and Libraries Connected, and is part of the Universal Public Library Health Offer. It supports people to manage their own health and well-being with specific collections of books focusing on different health areas. These have been created by health professionals and people living with the conditions. Titles can be recommended by a health professional, like a GP, for example, or people can simply visit the library and borrow them. We feel that there's much potential in this programme, and we're working with partners at the moment to develop reading groups around these topics. These will begin with support from ourselves, but ideally become self-facilitated. And additionally, we've designed a toolkit to accompany them. I've delivered a few pilot sessions working with a group of people with dementia, which have gone really well and prompted some really interesting discussions. And we're starting another reading group for university students around the topic of sleep in a couple of weeks or so. So that'll be really interesting to see how that goes. Digital one-to-one. This is our digital support offer designed to help citizens develop their digital skills and confidence. We offer free access to computers in all our 34 libraries, including free and safe access to the internet and Wi-Fi. We will have a tablet lending service available from April this year for people wishing to develop their digital skills from home. We have support from a staff team of 300 who have all been trained as digital champions and can have positive conversations about the benefits of being online and guide residents to do simple things online. We have the Digital One-to-One helpline, which is 0113 378 5005, which can provide help and support, and is the kind of first port of call really for many of our services. First steps with digital sessions have just started, and they are for complete beginners, delivered by librarians over 3 sessions, with a course running every month at libraries across the city. We have weekly digital drop-ins at local libraries to help anyone having issues with their device or who may want to know how their device can help improve their health, access library services or save them money. We have a digital platform page called Niche Academy with easy to follow guides on using popular apps and accessing our services from home. This is free. Everything is free pretty much that we do. There are specific modules on how to navigate the NHS website, download the NHS app, and troubleshooting for AccuRx, which can be used to attend virtual consultations. We've also received a significant award for a temporary staffing role to support the rollout of health literacy training across the service, which is part of a health and digital literacy pilot with Health Education England, SILIP, Libraries Connected and Arts Council England. This will build on the digital champion training and underpin the development work that we have planned around the offer. So we're really excited about starting with that soon. Moving on, digital health hubs. These are safe spaces in a community for people to access digital tools which support their health and well-being, with trusted people to signpost customers to relevant information, both online and in their local area, and help them, for example, access their GP online, download the NHS app and other tools. As safe community spaces staffed by trusted people, libraries are perfectly positioned to develop this concept. We already provide services to help people improve their health and well-being, and the digital services that I've just talked about And so this will develop this work. We are building a wider network of community, healthcare and third sector organisations, all sharing resources and working towards shared goals. This partnership working will enable us to refer customers to other partners if needed, and for them to refer to us. So, for example, perhaps a GP might refer a patient at risk of social isolation to the library service, where we can provide access to our groups. Or a librarian might recognise that a customer has additional needs that would be better catered for by another organisation. So, for example, perhaps somebody with a disability might be referred to an organisation like AbilityNet, whose volunteers are trained to support people with disabilities. We've been piloting our first digital health hub at Dewsbury Road, Community Hub and Library, and we're rolling it out to all our other hubs and libraries this year. So, volunteering. We've had a volunteering programme for many years now, and we've recently developed some new opportunities for people to get involved and give something back to their communities. Reading Friends and digital volunteers are the main ones at the moment. Reading Friends volunteers engage with participants in their own home or within a community setting to use reading in any format as a way of sparking conversations. They identify and select suitable reading material, make regular visits to participants, and provide companionship and conversation. Digital volunteers support digital literacy and creative digital sessions with a wide variety of people by mentoring at code clubs and other creative digital events. Some are also digital champions for our digital one-to-one programme that we mentioned, and they can deliver one-to-one support over the phone or via video in one of our libraries or other settings to help people learn basic skills. And we also work with others, such as the Public Health Resource Centre, to share information, campaigns and resources. And here are just a few statistics about the importance of reading and its impact on health and well-being. As you can see here, we have reading for just 6 minutes can reduce stress levels by 68%. Adults who read for just 30 minutes a week are 20% more likely to report greater life satisfaction. So these are just a few things to note, really. And we have a few messages to share. These are general messages about the public library service in Leeds. You may know most of this already, but we always think it's useful to remind people. So, as it says on the slide, we're open, accessible to all. It's free to join, borrow books and use our computers. We're safe and welcoming spaces with friendly and helpful staff. You can come in and spend time without having to worry about spending money. We're convenient. There'll be one near you, and there's a link to our website where you'll find your nearest library. We have books and information to help you manage health conditions, as I've mentioned, or find out more about subjects like anxiety, stress, or depression. We host regular events, talks, and workshops, and most of these are free. And here are some more targeted messages, which will be useful for some of you. So people who are better informed have better health outcomes. Libraries are well placed to address this through our extensive reach into communities, through the provision of free access to the internet, online resources, and our staff. We can empower people to access, understand, and use the information effectively. And we provide free, independent, and trusted sources of information. And so we'd like to ask, we have 3 asks of you today, just as I'm coming to a close. We'd love it if you'd consider becoming a member of the library service if you're not already, and encourage family and friends to join as well. It'd be great if you would like to talk to us about any ideas you have for using our services and spaces to help improve the health and well-being of our communities. And it would also be fantastic if you promote library membership and use of libraries to those residents that you're working with. And then I'll just finish with, these are my contact details here. Well, my email address, and then there is the general email address for Leeds Libraries as a whole. We have our social media handles there, and there's also a link to sign up to our monthly e-newsletter, which has lots of information about what we have coming up. And thank you very much.
Thanks, Lisa. There's a couple of questions that have come up in the chat. So we have a question from Tracy. She's asked, is the library service going to restart the home delivery service of books and talking books?
Shall I answer that one, Lisa?
Yes, that's fine.
So Lisa mentioned, I think, the Reading Friends initiative. And what we're trying to do is, obviously when we had to go into lockdown, it gave us time to think about our service provision. And what we're trying to do actually is move towards the Reading Friends model of delivery for our, what we used to call library at home service. And that means that rather than a van rushing around the whole authority, dropping off books to residents, we're wanting to work with volunteers locally so that those volunteers can spend more time with residents, because a lot of the people who are accessing that service are those who are most excluded and most isolated. So people accessing that service had no family or friends who could visit the library for them and obviously couldn't visit them themselves. So our learning is really that what those people really need is some social interaction. So we've been really successful in talking with the service users and really working to develop our network of volunteers as well, and asking them if they'd be interested in taking on that role. So we're increasingly shifting over to that. In terms of the talking book service, we're working more closely with the RNIB service that actually delivers that, so we can put residents in direct communication with them. So really looking to provide a more meaningful service than just a delivery van going out dropping off books, but actually provide that opportunity for a real befriending service, very much linked to having conversations about books and reading.
Thanks, Andrea. Next question is from Jaspal. She's asked, are the Reading Well books available from the Public Health Resource Centre? Rebecca Varnanen, if you'd like to answer this one for us.
Yes, we should have most, if not all, of those books. So that's been a really key part of our project to collect them together. So yes, we should be able to order them. And again, as Becky said, the interlibrary loan between the NHS libraries, I know that they have quite a few of them as well.
Yeah, I think that's one of our very valuable, potentially very valuable, but quite underutilised collections. And I think that's why we're trying to develop the programme of work that Lisa mentioned around the peer support reader development group, so that actually we can really focus those on people with maybe a specific long-term condition. So Lisa's mentioned the pilot work we're doing with the university around the issue of sleep. They're really interested in that. So just coming together over a 3 or 4 week period, reading a chapter of the book together and discussing anything that they learned from it and anything that they found that have been useful to support them better manage their own conditions.
So another question for you, ladies. So Tracy's asked, would Reading Friends visit residential care homes?
Yeah, I think we'd be very, as we start to develop Reading Friends, the key thing we need with Reading Friends is we really need to increase our volunteer base for that as well. So any of you that know anybody, or if you would like to consider becoming a Reading Friend volunteer yourself, I think it would be absolutely hugely beneficial. I mean, part of our community, I mentioned we're going to have a mobile library that's essentially going to be providing a service to the care homes. But on that mobile library, we're going to be hopefully, after we bed our service in, having a role for community librarians to, I don't know, once every so often, once a month, whatever, having a different focus for a visit to care homes, and it might be around digital skills. But I think Reading Friends is something we would really like to get developed. But as I say, that's a volunteer offer. So we would just love to work with more volunteers on that programme.
A link to a copy of today's slides will be sent to you via Eventbrite. Today's session has been recorded, so it will appear on www.bit.ly/LPHT films in about 2 weeks' time, so please visit the site to view it. Please complete the electronic evaluation survey for today's session, which has been emailed to you again from Leeds City Council via Eventbrite. For information about public health training, including future want to know more about sessions like this one, please visit leeds.gov.uk/LPHT. For resources and further information linking to today's topic, you can explore the Public Health Resource Centre website at leeds.gov.uk. www.bit.uk/PHRC. And to learn about specific resources that the PHRC holds, visit www.bit.ly/PHRC films, and you can watch resource demonstration films, book readings and more.